Implant dentistry evolution. To identify the present and see the future, we must look at the past. The history of implant dentistry is widely documented in literature. The purpose of this video is to highlight some transcendental aspects of this evolution from the 5th century BC to the 21st century after Christ. As Cervantes said in Don Quixote, "Pricier a tooth than a diamond." Today we might say, pricier an implant than a diamond. In the 5th century BC, Herodotus described the practice of medicine. In 2600, Hesi-Ra was recognized as the first dentist in the old Egyptian kingdom. The Code of Hammurabi in 1900 documented dental extraction procedures. Women of the court of ancient Egyptian dynasties received intraosseous implants of animal teeth and teeth carved in ivory. The first known sample of dental implant took place in the pre-Columbian era. Wilson Popenoe discovered in Honduras in 1931 a skull with an artificial tooth carved on a dark stone. Abdul Qasim, an Arab surgeon, described transplant techniques and produced them with bullock bones. Ambrosio Pare, a distinguished surgeon of the 16th century, highlighted the benefits of transplants. Dental transplants received the impulse of well-known individuals in the 18th century, such as Pierre Fauchard, the father of dentistry, and John Hunter, the father of dental transplants. Endosius oral implantology actually started in the 19th century. In 1809, Migilio introduced an implant with 3 gold pieces in the alveolus of a recently extracted tooth. Congdon was the first person to define the word implantation in 1915 as the operation to introduce a natural or artificial root in the alveolar apophysis. In the first 2 decades of the 20th century, Payne presented his implantation technique in the clinical sessions of the 3rd International Dental Congress, published in Dental Cosmos in 1901 in Greenfield. He made a basket-shaped implant manufactured with iridium and platinum, documenting the design and procedure in scientific literature. 6 decades later, this design would inspire some commercial brands. During the 50s and 60s, adjustments in shape were made through trial and error in sheet-shaped endosius implant designs, or blade implants. It is a period dominated by the work of Leonard Linkow and others like Liu, Pasqualini, and Muratori. Contemporary oral implantology began in the conference held in 1978 at Harvard, sponsored by the National Institute of Health of the United States and published by Paul Schnittman and Leonard Schulman. The Gothenburg Group began its experimental studies in the 1950s, led by Swedish professor Per Ingmar Brannemark, who first began conducting experiments with titanium implant chambers to study blood flow in rabbit bone. He discovered that the bone had integrated so completely with the implant that the chamber could not be removed. Brannemark called the discovery osseointegration. In the mid-1960s, he began his first successful experiments on humans. The Gothenburg Group also presented results of long-term clinical trials in a broad group of human beings. Years later, the American dental community held a conference on osseointegration in clinical dentistry in Toronto, Canada in 1982 and gave full support to the Gothenburg Research Group led by Brannemark. The amount of scientific data on the biological response to the implant of oral tissues, as well as clinical trials in humans treated with dental implants, have been the subject of research and of analysis of scientific evidence. From the decade of the 80s in the 20th century, a commercial explosion was generated, and the few existing systems at the time became hundreds of commercial offers and proposals, some very original, while others are just clones. Some loaded with research, others extrapolating research. However, there is no doubt that backing scientific research, the schools of dentistry and the departments of research and development have invested multiple human, physical, and financial resources that place oral implantology and care facilities at the top in terms of knowledge and state-of-the-art. Despite the predictable longevity of implant prosthesis, there is an ongoing interest in continuing to improve implant prosthodontic treatment and outcomes. One of the developments is the application of computer-aided design and computer-aided manufacturing, CAD/CAM, to produce implant abutments and frameworks from metal or ceramic materials. Precision of fit, durability, simplicity, and aesthetic material application are the main advantages of CAD/CAM in implant dentistry. The history and evolution of implant dentistry exceeds 25 centuries. It is difficult to recall any other field in dentistry with more research and resources invested. Every 21st century dentist must know about implant dentistry and must learn how to treat patients with dental implants depending on treatment complexity and his own professional training.